Hey, I'm Kevin with Acteon, and this is my lovely wife, Jodi. I was going to do this as a Facebook Live video, but unfortunately tomorrow Jodi is going to have a long day at work, so I didn't want to delay, so we're filming this, but I'm not going to shut the video off so you can see exactly how everything happens with no time delay and no fooling of editing, advanced editing skills, you know. Tonight I'm going to show Jodi how to do an extraction using the cube, and I'm gonna give her like a 90-second rundown of how to use it, and she's gonna do the extraction all on her own. Jodi, have you ever done an extraction before?
No.
Okay. You have any dental experience?
None.
Okay. You a doctor or anything?
Yeah, actually, I'm a doctor.
Oh, okay. She actually does have her doctorate
in education.
So she's not a dentist, but so you have no idea what we're doing. We're going to take a tooth out of this mold here. You're going to do that.
I'm going to tie a piece of string and pull it out?
Yeah, exactly.
Okay.
And then we're going to do it with the cube as well.
Okay.
So let me go ahead and show you a little bit about the cube. On the left side of the cube screen is, the plus and minus, go ahead, you're already there. That controls your irrigation, right? So if we're doing an extraction, you want to be at 80.
Ooh.
Right? But because we're using this little...
a brownie tray?
Yeah, I'll return it, I promise. We're using the little brownie tray. We only can hold, so much water, and I don't want it to overflow. So go ahead and put it down to 40. Right? Now, to the right of that, see where it says D1? That's your power setting. You want to keep it at D1 for an extraction, but if you needed to for other procedures, you can use the arrows right and left to control that.
Okay.
All right. At your feet is a foot pedal.
Ooh.
Right?
Okay.
You see that white thing? That's going to go ahead and activate the cube. This is the handle for the cube.
Mm-hmm.
Okay, so you're going to go and see in the back here, there's two hoses, or there's a hose and there is a cable coming in. Go ahead and hold down the middle button. Right there, and point this here.
Out at you?
No.
Do I need to do anything with the pedal?
Nope, just hold that button down. We want to get the water flow. We want to get all the air out of the lines, and we want to have just the water flowing.
Oh.
There we go, perfect. So now we have water flowing there. Now let's go ahead and put a tip in. So these are all of our extraction tips. We have a variety of tips. Some of them are angled for different ways because...
Well, and that's the dogs. Just
real
keep
time,
it going.
that's what happens. Guys,
I'm going to extract their tooth if they don't stop.
She's not that mean, I promise. So, all right, so we're gonna go ahead and use, let's just say, this one here, all right?
Okay.
We have others for angulation, but this is obviously not a real person's mouth. Go ahead and put that on the end there. Just go and spin it down.
Push and spin or just spin?
No, just spin it, yep.
Righty-tighty?
Exactly, lefty loosey. Yep. So then once you have it on here, we're going to use this wrench to go ahead and to tighten it all the way down. So
take it through the hole?
Yep, put it into the big hole, and then you're going to slide it into the middle so it sort of locks in.
Does that matter?
Yep, you're going to find a little square piece on there. Just sort of keep spinning it until you get it right in the middle.
Okay.
I find this is the hard. Now go ahead and try to yank or try to twist it as hard as you can. Right? You're going to notice that the rubber is spinning. Perfect. That's called our torque control.
Okay, that's
right.
easy enough.
Yep. So go ahead and take that off. This is a flat wrench if you wanted to do that, but I prefer this one.
Okay.
Now, what we have to do here is we have to take this tooth out. All right. Best way that I can explain it to you is imagine a tree in the ground. Okay, we want to take this ugly tree out and we want to put a really beautiful tree in. So there's a few ways that we can do that. One, we can just come and yank the tree out with like a forklift and just drag it right out.
And you have soil and a mess everywhere.
Yeah, exactly. So we're gonna like destroy all of the land and we're gonna destroy everything, and then we got to spend a lot of time putting it all back, and then I got to fix all the other landscaping, and that's gonna take time for that to grow back. Right? We don't have time. We want to place the tree in immediately. So we have the tree and we have all the roots coming off the tree. What we're going to do is we're going to take the shovel and we're going to go all the way around the tree and we're going to break all the roots. And then at that point in time that we've gone all the way around, there's going to be a perfect sphere around the tree, and we're just going to go ahead and lift the tree right out, and then we can place the new tree in that nice little root ball.
So this is my shovel, and that's my tree.
Exactly.
Okay.
So let's go ahead and let's do a single rooted tooth since this is your first time. This has just one root. These have multiple roots. So go ahead and take that tooth right there. And just as I explained, you want to go ahead and you want to push this tip down all around the tooth. All right, the tooth is held in by a ligament, right? It's called the PDL, the periodontal ligament. And what you're going to do is you're literally going to slide that in between. So if this is the tooth and this is the gum area, you're just going to slide it in here and all the way around. Now, you want to go ahead and step on the pedal and activate the tip. Have it moving before you slide it in. Now, keep in mind, you will get wet. This is during the coronavirus time, so paper towels are limited. So try to keep everything in here and be mindful of the fact that
My brownie tray?
yeah, your brownie tray could let water out. But go ahead and just push it and literally just push it right through and follow along the tooth line all the way around.
Okay. My pedal's on first before I push,
Yep,
right?
push the pedal on and then activate the tip and then push it in.
Good.
Can you reach it?
Yeah, got
There
it
you
now.
go.
I just want to make sure. Oh my gosh.
Yep, easy, right?
Yeah.
So
How
now
far do I have to go down?
just keep going all the way down. Now pull it back up. You want to go in sort of a zigzag motion. You want to keep the tip moving, right?
Okay.
And you want to make sure that you sort of maybe just do little jabs until you can get down.
Ooh, okay. Oh, that's a lot easier. See, I think I was going too far. Oh, I'm not very good at this.
Keep the foot pedal going, okay? And then go ahead and push it all the way around.
Oh,
Now-
now, what happens when the tooth is too close together like that?
Yep, so when you're going between the teeth, you're gonna have to go in at an angle.
Oh, so that might be if it was a real person's tooth when you use the different tip things.
Exactly.
But since I can move this person's head around, since it's not really a real head,
Yep.
what happens if I miss a spot?
You'll notice it when you try to remove it with the forceps. There's still something sort of grabbing. Very similar to like if you were cutting the tree and some of the roots are still connected, you're sort of gonna feel that there's a root still connected that you have to break through.
I don't know if I was supposed to do that, but since I realized that I didn't have enough room in there between the tooth, I came back to it. It seemed to have more room now.
Yep. And then also make sure you go in, there you go, at some other angles.
So I'm assuming if I had a real person here, I'd have something sucking this water out.
Yeah. I would be your assistant and I would be
Okay.
doing that. But unfortunately,
We don't need a water sucker.
exactly.
So
Do you feel as if you go
I-
all the way around? Let me know if you feel as if you...
I think I'm about ready. I just want to make sure between these two teeth over here. Like, can I go at an angle to get
yeah,
between
absolutely.
them? Okay.
Right, and pull it out. Don't want to leave it. You just want to
Oh, yeah.
keep it moving,
And then pull it out.
you know?
So if I didn't do this with this type of machine like this, what would I be doing? Just pulling?
No, there's different things that you can use, like they're known as elevators, and essentially you're kind of just trying to leverage the tooth out. The problem is that when you do that,
I think I did it. How do I know?
okay,
Sorry.
so let's go ahead and use the forceps. Try to grab the tooth and give it a little spin.
Do I try to wiggle it at all, or just
Yeah,
try
you
to
can give it a little wiggle, but do you notice?
Wow. Just like that.
Yeah, there you go. So you have been able to remove the tooth.
Wow.
Right? And there you go. And now the socket is perfect. Let's see if you can see that.
First tooth
Yep.
extraction.
So you actually did a better job than some other people I've ever seen use.
Yes,
So-
because I'm a doctor.
She's a doctor. So we are 9 minutes into this video, and she actually. So look, if she can do this in 9 minutes, if she can extract a tooth in 9 minutes with education, being educated, learning how to use the machine, having no prior experience, I don't see any reason why anybody else can do it. Now,
And right now, it's even better. That means that's only 9 minutes you'd have to be around a patient.
there. So that's an even good point there. So if you're seeing an emergency case, right, you want to get these patients in and out very quickly, but you don't want to cause any trauma. You don't want to have them have to go to the or you don't want them to go to the grocery store afterwards and have to get medication because they're swollen or anything else. You want to leave them in an atraumatic fashion so that they can go straight home and relax and not have any other complications. The best way to do that is to extract a tooth atraumatically with the cube. And as you can see, it is really that easy.
Do I need to take this thing off or anything?
So
Okay.
same way. You just go ahead and
Find that little doohickey.
yep,
Ooh, that's. Make sure I was going to the left now.
the other left, yeah. Yeah.
And then I can unscrew it with my fingers the rest of the way.
Yeah, and go ahead and put it back in the extraction kit.
Beautiful.
Yeah.
Okay.
All right.
Just like that.
So that'll be a couple
Okay.
$100.
Awesome blossom then.
Yeah. So that's it. Any questions? Feel free to give me or your local Acteon rep a call. But yeah, that's the cube. Easy, right? Thanks, Bubby.
Absolutely.